Shailabh, thank you so much for taking time off.
Thank you
from the busy Catalysing Social Impact Forum. You were just saying just before we started that people don't cooperate enough in our space. Are you seeing a slow movement towards collaborative action? Because some people have found out it's really not easy to do this alone.
I'll be very blunt with this. I don't like to mince words. I think what we are seeing is that people from the corporate sector are entering into the development space now, and they are bringing these kind of collaborations. Where I have seen collaboration in the development space is from the groundswell movements, where people have really come together to lead, people's movements. But if you look at the development space, I may be killed for saying this, but I have not seen collaborations for scale. So yet, yeah, definitely yet. And I think the fresh breed of people who are coming into development space with, corporate backgrounds, they are more open to collaborations than typically people who have been in this sector for the last 20, 25 years. They talk a lot. They go to conferences. They have lovely dinners. But you see very few collaborations.
Right. I'm sorry you've had that experience. I think I've
but that's
but it's a lesson for all of us.
That's if the thing is, if you don't call it out, it will never be. It might be another tragedy. So my job is to make sure that I call it out, because I've been party to it. So I'm just calling it out.
I think
not saying that there may be
worse.
examples where people have collaborated. I'm not saying they have not. But as a ecosystem, definitely you don't see these right? What you're seeing in the last 3 to 5 years is very new.
It is new. I'm part of the Partnership for Mother Newborn Child Health.
Oh, okay.
And that has maybe 12 to 16 different constituencies, people who speak different languages. There's about 100 plus countries, from civil society to heads of state to UN and academic and research institutions. So everyone's speaking a different language, but they're really having a shared vision in front of them. And this includes the corporates that you were talking about. I think there are some movements and a realization that if we don't collaborate, this ain't going to solve itself. We have the movement like Every Woman, Every Child, really putting the societal problems in the center. But I hear what you're saying. I mean, it still goes on, and there's a legacy about it. But I certainly see there's a realization that there's an urgent need to not have just the practitioners and the experts doing stuff like solving societal problems, but really open it out for anyone with passion and commitment and shared vision, and not necessarily those with personal agendas. But I want to move you to a subject that we both like a lot. And earlier this morning, you challenged the forum to look beyond and create a groundswell. Tell us a little bit about Uplift Mutuals.
We started as a reaction to an event that happened to one of our women leaders, where we realized that she could not get good care on time, and that's why she lost her life. While she lost her life, her husband lost his livelihood, children lost their mother, and it was a very sad story to tell. And at that point of time, insurance was not the in thing. This is 2004. And when we talked to an insurance company, we realized that the products that they have, one, do not suit the needs of the women. Second, they're extremely opaque. They're not transparent. Third, they're only focused on hospitalization. So when we looked at the product, then we looked at the market, that every year insurance premiums have been rising, and there is massive fraud.
Right. Wow.
How do you bring a product like that to women who cannot pay that kind of premium year on year?
Absolutely.
And and also the fact that where does the solidarity part that we were talking about women feature in insurance, because insurance is a solidarity based product.
Yeah.
So we realized that there is a design problem, massive design problem in health insurance. First, it is not health insurance, it's hospitalization insurance.
Yes.
Second, the entire focus is when you fall ill. Now, when we work with these women, we want to
keep them healthy. Exactly.
And, so that they don't lose their livelihoods
Yes.
and they do not fall into the poverty line. So the whole idea of intervening when you're already in a hospital, and we heard Dr. Devi said it, so scary data that he says it looks nice. When I say it, people question, but yeah, it's a fact because we are from the people's side, so you say people say that you are biased. It's not about bias. We have seen very good doctors but extremely rogue hospitals.
Right.
So I think
hospitals are a business.
It's
a business that lives off people's ill health.
Yeah. So when we looked at the design, this was the second part, and the third part we realized was, while the notion of community is very romantic and people love this, it's easy to sell, it is not what is required to run health insurance, because at the end of the day you have to run health insurance.
Absolutely.
And for that, data is critical. So we were one of the pioneers in the sector in India in the microinsurance space to have our software in 2004. And while the claims were decided by women, it was based on data.
Right.
So since 2004, every claim meeting, because in this model, women decide on claims. It is based on data. So it's not your brother, sister that you are giving a claim to. It's a system, it has rules. You have to follow the rules. If you change the rule, it changes for everybody, no exceptions.
Right.
So we did this, and when we integrated this entire model, the design came out as a mutual. Now, so mutual is basically another way of doing insurance, or how insurance primarily involved.
So describe how mutual works.
So what does an insurance company do? They pool the risk and put it into a company.
Yes.
And there are shareholders who make money out of it.
Yes.
We also do the same thing. We pool the risk and put it in a society. But nobody makes money out of it because everybody owns it.
Right.
So there are three parties in health insurance: insurance company, the insured, and the healthcare provider.
Yes.
In mutual, there are only two parties because the insured and the insurer is on one side and hospital is on the other side. It's an easier business to manage. So a lot of demand side fraud that happens gets taken care of because there is a peer pressure model.
Right.
And because we are creating demand, we can actually talk to the hospitals better.
It's still hospitals though, it's not prevention.
No, so I'm telling you the insurance part.
Insurance part, okay.
So the insurance part, while it looks at hospitalization, as I said, we realize that if we don't make sure that our women don't fall ill, it will go out of bounds. Right. So, and the question that we were to answer was, this lady who asked this question, if I don't fall ill, what happens to my money?
Right.
And that's a question that has been haunting me for 14 years. So everything that we have done is an answer to that question. And so what we do is we have doctors on payroll who organize outpatient care in the slums or villages. We have a doctor on a 24/7 helpline. We have health screenings based on morbidity data coming out. Based on the same data, we do wellness sessions with the women. And now, recently, we have added not-for-profit medicines. So the idea is that wherever there was a pain point, and this has taken some time for us to design because we were also realizing as we were going forward what is required, what is not required. The most critical part, I think, what we have figured out is that, so let's take Pune as a city. One treatment has 5 different price points.
Right.
And the poor ends up paying the most.
Yes, actually.
So what we did was we figured out, I literally begged with hospitals that I'm working for the poor, give me, I don't need concession, but tell me the right rates. Some were good, some were, leave the word.
Not so good.
Leave the word. So obviously there are good people in this world. So we got schedule of rates from them and we realized that where should the person go? And so the system works like this. So ideally you come to OPDs. So, and 80% of the diseases you must know can be treated at the OPD level. So we do that. And if there is a hospitalization, a calls come to our 24/7 helpline. We know where the person is standing, which are the nearest network hospitals, what is the rate list. So if you don't have any money, we can solve that also. If you have some money, we can solve that also. So we don't force anybody to go anywhere. But what we do is what I call is healthcare intelligence. So like the Intelligence Bureau,
Yeah.
we are creating that which doctor will operate or do a particular process,
Procedures,
medical process at a particular cost in which hospital.
Right.
And this has worked very well with us because we save roughly about 60 to 70 lakh rupees of our member
Wow.
every year just doing this.
Wow.
This would be our net
Brilliant.
claim cost. So, and when we started, nobody used to go to government hospitals.
Right.
And our focus since beginning is that how do you make people go to government hospitals? We realize it's a facilitation issue.
Yeah.
Today, 40% of our claims come from government hospitals.
Wow.
But it has taken tremendous work.
Sure.
Tremendous work.
And government hospitals have also become better quality, more
Yes,
respectful of the poor.
you understand when I say government hospital, many people question why you're sending people to government hospitals. Well, all the doctors in Pune come out from that same government hospital.
Yeah.
So there was a case where this lady's husband fell down from he was a painter, he fell down and he was asked 3.5 lakh up front.
Wow.
And the private hospital was not even admitting him, he was outside. So she calls on the helpline, we tell her that, wait, we'll just figure it out, give us 5 minutes. Doctor checks it in his database, finds out that the same doctor is going to treat in Sassoon also.
Okay.
Obviously, there were some things not available in the hospital. You had to buy it from outside. The stent that went into his had to be bought from outside. But the cost came from 3.5 lakhs to 35,000.
Wow. Yeah.
So even if you don't do health insurance,
Yeah.
it's a massive need
Yeah.
that there are public services available which people do not know. If they know, they do not have misperceptions about
Right.
it.
Right.
And it has been created by default
Right.
by private players, I think.
So let me summarize. So it's not. It's so we started this conversation really looking at mutuals, insurance. But I'm hearing two things. One is the whole financing piece and financing piece using peer pressure to overcome adverse risk.
Yeah.
And the second piece is actually the important role of facilitation. And with this and many more, I think we should be able to achieve universal health coverage.
We should. See, the thing
the
is,
most excluded?
yeah. See, the idea is that any country that does not look at UHC is going to lose out.
Yes, absolutely.
Whether it happens in 10 years, 15 years, 50 years, I cannot say that, but it's going to happen. You need to guarantee a basic level of healthcare to each of your citizens.
Absolutely.
And that's where government has a massive role. Government has now taken the role of funding the financing side,
Yes.
which I have a personal issue with because they were supposed to create the infrastructure, not the financing, because there will be a problem when the finances will not be available. And that's something that the European countries are facing themselves. So I think if the infrastructure is mostly private, it's going to be extremely difficult.
Yes.
So UHC has a massive role to play into this. And that's where I feel that, at one level, the risk should be borne by people. At the other level, there should be government. No need for insurance companies.
Right. Yeah, I agree with you. So more power to you and outfits like yourself.
Thank you so
Shailabh.
much.
All the best, and I hope you have a rest of a productive forum moving ahead.
Yes. Thank you so much.
Thank you.
Thank you.